Welcome to this three-part series on PCOS, where we basically just talk about the diagnosis of PCOS, what it is, how patients present, and then in the second and third parts we'll talk about fertility, how it impacts fertility, and what the management of PCOS is. So PCOS is a metabolic disorder that affects women's reproductive system. In other words, their menstrual cycle. It impacts on often there is weight issues, and then also abnormal hair or acne might be part of this condition. So it's a very common condition among the patients that we see in the reproductive age group, affecting about 15% of the population. Symptoms that these patients usually complain of or that they present with is a combination of irregular cycle. Their cycles might be variable length, they might skip the menstruation, or they might have prolonged periods with breakdown bleeds that is heavy and often then also experienced as painful, but irregular menstruation is a big part of this. And then also the what we call androgen excess symptoms. In other words, that might be acne that women present with, and or abnormal hair growth in the male distribution. That might include and if we talk about abnormal hair growth, it is hair in the chin area, the moustache, the abdomen, and then might even be in the upper thigh if it's severe. A common thing, part of this is weight gain. About 80% of these patients present and also with excessive weight. That is the most common things that women might present with. So PCOS is diagnosed. There is no single blood test that you can do to diagnose PCOS. It's a diagnosis made based on the symptoms and the presentation of the clinical findings of these patients. And in 2023, the international guidelines on the diagnosis of PCOS was updated, which is now known as the modified Rotterdam criteria. These include then menstruation apnea or ovulation dysfunction, and then also symptoms of hyperandrogenism, which is the excessive hair growth and acne that we talked about. And then the other criteria is the ultrasound diagnosis of polycystic ovarian morphology, in other words, the appearance on ultrasound, and these include at least 20 follicles in any ovary between the sizes of 2 to 9 millimeters, or enlarged volume more than 10 mil on either ovary. So, and then additionally, a high AMH was included in the diagnosis. So what you need is at least 2 out of 3 of these to make the diagnosis, and we wouldn't do both PCOM, in other words, ultrasound diagnosis, and AMH. We should use either of those. So when the diagnosis of PCOS is then suspected based on these criteria, it's important to exclude secondary causes, which includes thyroid abnormalities, adrenal causes like Cushing's, and then also adrenal or ovarian tumors, and don't forget about medications that patients take, which might also have an influence. So are excluded, then the diagnosis of PCOM can be made. Okay, so as we mentioned, then there's no specific blood test that can confirm the diagnosis, but there is specific tests that are important. Firstly, I think it's important that the patient be properly examined in terms of these clinical findings of acne, hair, weight, abnormalities on the abdomen, like striae or the stretch marks, that can be an indication of other endocrine abnormalities like Cushing's disease, for instance, as well as have to exclude these, and then the blood pressure. So the clinical examination is important, and then depending on the age of the patient, if it's an adolescent, it's important to know that the ultrasound diagnosis of PCOS should not be made in a young patient. In other words, adolescent less than 18 to 20 years of age, because it can be a normal finding. As well as AMH, we know that the AMH is the hormonal level that's now also been included in the diagnostic criteria for PCOS, but these levels peak between the ages of 20 to 25, so it should not be used in a young person. Then blood tests that we will do, so in adults, we will then obviously be the ultrasound, looking at the ovarian morphology is one of the things that we use. And then blood test, important then is to exclude other causes. That includes the thyroid abnormalities. Then also we look at hormonal tests, which includes female and male hormone levels. And then also in specific instances where the testosterone levels are high, we will also include tests for adrenal function to try and see where the source are from. Very important is glucose test, and the gold standard is the glucose tolerance test. That's a fasting test where we look at the baseline glucose 1 hour, 2 hour values, and because diabetes is very common in this group, and then also I think that would be your most important blood test to do to exclude secondary causes. And we know that patients with PCOS it's a lifelong condition, and they have specific risk factors, and we have to look at these baseline values. Okay, so the important thing is these patients might present as either young girls brought in by their mother, often with a history of menstrual irregularity. That would be your adolescent, typically between the age of 15 to 18 to 20 years, and then might also complain of abnormal hair growth or severe acne, and weight problems, which is part of this. Adults will usually present, and if we talk about adults, that would be women, the reproductive age group between the ages of 20 to 40, that will present with fertility related issues. And then on the history, there is irregular cycles of variable length, and then also often then hyperandrogenism that we spoke about, which is the excess of hair and acne, and then weight gain, which is part of this problem. So when these patients present, it is or you have these complaints, it's important to see a healthcare practitioner who should then first do a complete clinical history on these patients, which include their cycle history, the age they started with menstruation, the history of the acne, hirsutisms, and then also a familial history of diabetes. There's often parents with hypertension, overweight problems, dyslipidemia, meaning high cholesterol, and then also to exclude other things like medication, but it's important to have a high index of suspicion in these patients. And this concludes then part 1 of our first series on PCOS, and following 2 sessions we'll talk about the long consequences, the management, and fertility related management of PCOS.